So I'm glad you knew. Thank you. I tried to get a message to you. I'm not sure if it reached you.
No, I didn't get the message.
Oh, I'm sorry. Yeah.
I see Addie is here. Oh, Rabbi Benji is here.
Rabbi Benji's here. That's nice.
So did it ask you for a password when you logged on?
No.
No.
Good, because for some reason now it's telling me you do need a password, so I hope everyone can get on, but we will see. In case people do.
Benji?
Yes.
Hi. So for the password, it's just the number that you provided with the website.
Perfect. Okay.
That's what I used. It seemed to work.
Good. Okay. Hopefully everyone can get on then. We'll give it a few more minutes and then we'll.
I hope so. Yeah.
I'll get my screen ready.
Brian, you look like you're outside. Neil, you look like you're outside.
Outside, yeah. This is my backyard.
Oh, very nice.
Yeah, thank you. Thank you. Yeah, actually.
There.
Okay, one more minute and then we'll start.
בשביל זה? כן, הוא שלח הרגע, הוא לא חושב שהוא צריך.
Hello.
How nice. Please close this window, Miles. Otherwise, the bugs will come in. Yeah, I'm in a class.
Hi, Neil.
Hello, how are you? That sounds
How are
like.
you?
Oh, there you are, Ellen. It's nice
Yes,
to see
here I
you.
am. A little
that's
messy,
nice.
but I'm here.
A little wispy, you said?
Messy, I said.
Oh! I said, my head is getting wispier by the day here. I don't know when I'll get a haircut next.
Forget it. You know, put an additional hat on.
That's an excellent idea. Excellent idea.
Messy. You want to sit here? Do you want to sit here? Bring a chair in.
I don't hear Rabbi Benji.
Okay. Thank you, Irene. Okay, should be able to hear me now. So beginning with a short introduction before we get into the talk and questions and answers with Dr. Steiger. When the Jewish people left Egypt, they were traveling in the desert and they were attacked by the nation of Amalek. And the Torah describes how Moses stood on a rock and he lifted his hands up to the heavens. And as long as his hands were pointing to the heavens, the Jewish people were victorious. They were winning the war. When his hands got tired and he would lower his hands, they would struggle in the battle. And as a result, his two students supported his hands. And the point behind this was when his hands were lifted to heaven, it would remind the Jewish people that their true protection came not from the battlefield, not from the weapons, but the true protection came from God. And therefore, as long as his hands were pointing to heaven, the Jewish people were victorious in the war. And the obvious question is, if the victory comes from God, if our protection comes from God, then why the need to even fight in the battlefield? Why even take up arms? Why do battle when God is the one bringing about victory? But we know the answer is God wants us to participate in the process. He wants us to partner with him. So while we recognize that God is the one who brings salvation and victory, at the same time he does it through his partners who are fighting on the battlefield. And the same is true with the battlefield that we face today. It's a two-pronged approach that we have. There's the spiritual approach. We have to put our hands up to heaven and remember where our protection comes from. And we remember where we can place our trust. We place our trust in Hashem, that Hashem will take care of us. At the same time, God also wants us to partner with him. And therefore, we have to do our part, taking the precautions that we need to take, staying at home, washing our hands, and all the things that we do to protect ourselves. But in addition, Hashem is very, very careful when he chooses partners. And he has chosen some very special partners to bring direct healing to the world today and to really win this battle for us. And those are the doctors and the nurses who are really on the front lines of this battle. And they are the ones who really were chosen as God's partners. So it's really an honor that we have today on the line with us on this conference, Dr. Steiger, who is the chief pulmonologist at Mount Sinai and Beth Israel. He's also a dear friend and a community member. He recently moved away from Hastings to the city, and we really miss him here in the river towns. But he is just one of the many doctors who were chosen or given the merit to be a partner with God in bringing healing. But on the topic of trust in Hashem, the spiritual aspect of what we need to do, so I just want to share with you very briefly, not to take too much time. I know you're here for Dr. Steiger. I'm going to share my screen where there's a synopsis from the book Shar HaBitachon, Gate of Trust, or Gates of Trust, where the author differentiates between faith in God and trust in God. And I think it's very, very instructive as to what we're trying to do today, because obviously many of us are really thrown off. We weren't expecting this, and our lives have been turned upside down. And in a sense, the whole world has been brought to its knees by a tiny little virus. And we realize that we really have very little control. And as a result, it's the perfect opportunity to develop our trust in Hashem. So this is the screen I'm sharing with you is a brief synopsis of one of the ideas in the Gates of Trust, where he differentiates again between faith and trust. Faith is the belief in God's existence. Trust is that he takes care of me and wants my best. Number two, faith is the belief that all we have is from God. Trust is the knowledge that God will provide. And number three, faith is the belief that all God does is for the good. Trust is the knowledge that we will see that good. And I believe this really sums up the Jewish view on trust, which is so crucial at a time like this when we realize that we're not in control, and many of us feel very vulnerable. And while that can be very painful, perhaps, or upsetting or unsettling, it's also an opportunity to really awaken or nurture or develop this trust that can be so helpful in life. So with that in mind, that's the spiritual part. We're going to turn over to the more practical part with Dr. Steiger. And Dr. Steiger is going to give a brief introduction about himself and his work and what he's seen in the hospitals. In his position as chief pulmonologist and chief of critical care at the hospitals, he's seen quite a bit, and he has quite an extensive knowledge regarding this virus and what's going on. So after his introduction, we'll open up the floor for questions and answers. I think the best way to do it will either be to put it in the chat, so I can leave everyone on mute, or you raise your hand, I'll unmute just you, and this way we can keep it kind of orderly here. Okay, so David, whenever you're ready, the floor is yours.
Thanks, Rabbi. Can everybody hear me?
Yes, we hear you.
Okay. Well, thanks for your introduction. And Rabbi, thanks for giving me this opportunity to speak to all of you. I'm honored and humbled, and I feel very fortunate to be given this opportunity. So very briefly, I work at Mount Sinai West, which is the name of the old Roosevelt Hospital, 59th and 10th. I work at Beth Israel as well. And in my capacity, I'm looking after a lot of unfortunate patients with COVID. Many go home, and some need the help of the intensivists in critical care. Let's talk a little about it, just for a few minutes, and then we can open up for questions. So what is COVID? So COVID stands for coronavirus disease 19, as in first described in 2019. How did it all come about? Well, there were some cases of pneumonia in China, in Wuhan, in December 2019. And no one really knew what the cause of the pneumonia were. And indeed, these patients who had this type of pneumonia did not respond to antibiotics, and many of them had died. It became clear that there was and originally the virus, the disease was, the patients who had it were tracked to a common source. It was a food market, a fish market in Wuhan. And that's perhaps how it all began. And I could discuss that in a minute. But by January, the actual cause, the virus, had been sequenced. So we know a lot about it. It's a coronavirus, and we've all probably been infected by coronaviruses in the past. Now, these 4 coronaviruses are responsible for the common cold. And most of us get it from time to time, sometimes once or twice a year. There are 2 coronaviruses which caused an epidemic in 2003. That was called the SARS virus, SARS. And that had a very high mortality rate of about 10%. There was a second coronavirus epidemic in 2010. That was called the MERS virus, MERS, standard for Middle East Respiratory Syndrome. And actually, it principally affected people in the Middle East and actually Saudi Arabia. And it was transmitted from camels. And that had an even higher scary mortality rate of 30%. So as I said, in December, a new disease was discovered. It was given a name in the end of December. And now, unfortunately, it's a pandemic. In other words, it's having global effects. And most people are asymptomatic. Some people who get the disease have mild symptoms, a sore throat, loss of sense of smell or taste, nasal congestion. About 10% of people get nausea or diarrhea. Then more people get fevers and chills. And then if it progresses, you get a cough, which progresses to shortness of breath. And that's when we get concerned. And that's when you may or may not have to come into the hospital. There are a lot of treatments we're trying right now for this virus. We've made enormous strides in treating bacteria, but with respect to viruses, we're not as up to date. You may have heard about a cocktail, hydroxychloroquine. It's an anti-inflammatory agent that patients with lupus and rheumatoid arthritis have been using for years. It may be a benefit. And in patients who have mild or worse disease, we're actually giving it for 10 days. We give antibiotics as well at the beginning in patients who are hospitalized. We give supplemental oxygen if you're short of breath. And if patients get sicker, then there are a number of studies going on right now, including novel antiviral agents, anti-inflammatory agents, because the patient suffers from significant inflammation affecting not the lung, but other organs as well. Steroids are sometimes given. And for the worst cases, we now have a pool of patients, donors, who've had the virus, have survived, are doing well. They have antibodies. And those antibodies are taken from the patient and given to a patient. It's called plasma therapy, and it's actually very successful. And if you remember the Ebola outbreak over 5 years ago, that technique was similarly used, harvesting antibodies from people who got better and then transfusing it into patients. So that's a brief introduction, and I'm happy to take any kind of questions.
So if you have a question, either put it in the chat or you can raise your hand and I'll unmute you. You can unmute yourself also. Alan, go ahead.
Doctor, I heard from a knowledgeable person that some of the problems with the breath problems in persons suffering from this virus is seriously impacted by something called cytokine storm. Have you ever heard of that?
Yes, sir. So cytokines are proteins that our cells produce, which are used to fight infections. When we are insulted by a virus or bacteria, we produce cytokines, which normally are used to recruit all our cells that attack the virus or the bacteria or the fungus, whatever the insult is. Sometimes that reaction, that inflammatory response is excessive. And that's the word we use. It's called a cytokine storm. So one of the focuses of interest right now in treatment is inhibiting our inflammatory response, which can be excessive. In other words, the idea is our own immune system is actually causing damage by an excessive, exuberant overreaction to the insult. And here the insult is a virus. So in the hospitals throughout the country now, we are using anti-inflammatory medications, including steroids, but more specific, targeted anti-inflammatories, anti-cytokine therapies that can dampen down this excessive inflammatory response.
Thank you, Alan. Anyone else want to ask a question? You can unmute yourself.
I do.
Go ahead.
My wife and I, Rose, just took the test a couple of days ago. And my question is, how accurate are these tests? We took the test in Glen Island Park and on Friday morning, and we expect the results by tomorrow or Tuesday. The question is, how accurate, in your opinion, are these tests? Are there false positives, or are they pretty accurate?
Okay, that's a good question. I imagine the test you're talking about was the swab,
Yes.
Through the nose. That's called a nasopharyngeal swab, which is a little uncomfortable. So there are no false positives, I can tell you that, number one. Number two, there can be many false negatives, up to 50%, perhaps 25 to 50%. So how could that be? Well, sometimes the test is not done properly. The test that you had was a swab was put through the nose, the back of the nose, and it's actually very uncomfortable. And theoretically, the person who's swabbing should do it for about 15 seconds. Now, a lot of patients are visibly uncomfortable when they have that test, and they pull back, and the physician or nurse pulls back as well. And often the swab isn't done for the prerequisite amount of time for 15 seconds. Thirdly, we are shedding viruses at different times of the disease. And when that test is done, it may be either too early, when there's not enough virus in the back of the nose, or we're getting better and we're not shedding enough virus to be detected. So depending on who's doing it and where you are, it may be negative. It could also be negative, true negative, if you do not have the disease as well.
The test we received included swab tests in both nostrils and in the throat.
Yeah. Yeah, so ideally, there should be two tests. And what they're probably also looking for is other viruses that are around right now. There's about 8 or 9 different viruses. And at the beginning of COVID, they can all resemble the same. Headaches, fatigue, sore throat, nasal congestion, coughing. There are many viruses around right now. Admittedly, we're probably just past the flu virus, influenza A and influenza B, which probably was a peak in December and January, but they were probably tested for those as well.
Thank you.
So good luck with that.
We have a question, David, from Mark. He asked, how close are we to having a serological test to determine if someone has had COVID-19 and therefore may be immune and or be able to give plasma to others?
Yeah, so very good question. So hi, Mark. Next week. So I've been told at Sinai that's going to be available next week. And I can let you know, Rabbi, if people want to test. But beware of the following. You may have had the disease and indeed you may not have known you had the disease, it takes probably 2 to 3 weeks to develop the antibody. So if the initial test is negative, it may not mean you haven't had the disease. It just means you haven't produced the antibody yet. In other words, you could have had the disease, you were symptomatic, you got better. You went to have the antibody test, it was negative. It doesn't mean that you didn't have the disease. It just means it takes time, a few weeks for you to develop the antibody.
Thank you. So Mindy, go ahead, Mindy.
Can you hear me?
Yeah, I can hear you. Hi.
Hi, how are you? Thank you for doing this, Rabbi.
Of course.
And you, doctor. Thank you very much. There's a lot of mixed messages about when people who are testing positive and then recuperate and get better with their symptoms can actually are no longer contagious. Can you address that issue, please?
Yeah, it's a very good question. And the reason why there's so many mixed messages is because nobody really knows. We probably shed virus from up to 10 days. In some studies I've seen up to 1 month. Now, it is possible that the virus we're shedding at 1 month may be dead virus. So I think that the highest peak of live virus we're shedding is between 4 and 7 days. At work, if a healthcare worker has had the disease, they're allowed to go back if it's been 1 week since the beginning of the disease and they've been symptom-free for 4 days. So the rule of thumb, just to summarize, if you've been sick and you're feeling good for 4 days and your symptoms began a week ago, then you're probably not that infectious, if infectious at all. Yeah.
So if you still test positive, because unfortunately I went to a conference where so far about 45 to 50 people have tested positive.
Yeah.
And those people are saying that even when they get a positive test again, they're being asked to go back into quarantine. So I mean, there seems to be a lot of different opinions out there.
If you want to be completely safe and you are concerned about your colleagues and friends and loved ones, I would put yourself in quarantine for 2 weeks.
After you test positive?
Yes.
So after you test positive,
yeah.
Quarantine for 2 weeks. Yeah. And then if you still test positive?
No, you will always test positive. Well, I would not recommend you repeat the test. If you're talking about the test looking for the virus, you can test positive more than once or twice. The virus they're detecting may be dead. So I think the rule of thumb is you are probably infectious from 4 to 10 days.
Once you are symptomatic or before that, or they're not clear?
If you are 7 days from the beginning or 4 days without symptoms.
And when you say without symptoms, you're talking, what do you consider symptoms? Because people are telling me they're exhausted for weeks afterwards and they're coughing for weeks afterwards.
Yeah. You know, we really don't know. Just like the flu, we've all had that. You feel fatigued for many, many weeks in some people.
So just to clarify, you're saying 7 days from being tested and 4 days without symptoms.
That's correct. That's what those are the instructions we have to follow at the hospital. And if you're asking me how good that information is, I think it's a compromise.
So we have a few questions lined up. First of all, William, I see you're waiting over there. So if you can unmute yourself on your computer, because it doesn't let me unmute you. Go ahead.
Can you hear me now?
Yes.
Wonderful. Of the people that go to the hospital, what percent go into intensive care, and what percent of those people go on a ventilator?
Yeah, it's a good question. So you must remember, most people do not enter the hospital. Most people do not. Most people are either asymptomatic or they have mild disease. So we're looking at a skewed population. Those who enter the hospital, about 79% leave the hospital and don't require the intensive care unit. So about 1/5 will require the ICU.
Then we have a couple of questions in the chat. How can a younger person get a test if he has many of the symptoms?
You'd have to you could go to an urgent care The hospitals in the city have these tents outside the hospital now. Mount Sinai has them. Beth Israel, Sinai West. You can walk in to the ER. They'll send you to the tented area, maybe outside the hospital, and you can be tested there.
Thank you. Ingrid, go ahead.
So here in Hartsdale, the high point of Hartsdale, how can we access a test?
It's a good question. You should speak to your regular doctor.
Okay.
Yeah. And
Okay.
he or she will know. He or she can direct you.
Okay.
I think it's easier now to get a test than 2 or 3 weeks ago.
Okay.
Yeah.
Thank you very much.
So,
And then we have another question. Any other medicines out there besides hydrochloroquine that's out there?
so hydroxychloroquine is available if you get sick as an outpatient, and we give it for patients admitted to the hospital. We give antibiotics empirically. We give steroids. It's controversial, but I think one of the earlier questioners talked about the excessive inflammatory response that we produce against the virus, and perhaps steroids as anti-inflammatory agents may be helping. There are more precise, targeted therapies available, anti-inflammatories, and there are studies available right now using certain antiviral agents as well.
Thank you. Dr. Steiger, if I can just ask if you can lower your camera a drop so we can actually see. That's perfect, actually. That's good. Okay. Thank you. Ingrid, go ahead.
So about anti-inflammatories, is it true that people at this time should avoid taking Advil and all other ibuprofens?
Yes. Now,
Okay,
I'll be honest, I don't know why so-called non-steroidal anti-inflammatories are not helpful, but that's a good recommendation. You can take Tylenol, but not anti-inflammatories.
Next question, is there a blood type that is less susceptible to the virus? Also, what path do you see to people being able to go out again?
Yeah, those are two big questions. For the first one, there probably is. There are probably a lot of risk factors we're not familiar with. I could, recite some of the risk factors that you're all familiar with, but with respect to blood type, we're not sure yet. And when your second question is, when do I think people will be out and about and free? Well, I think the good news is in New York now, the number of deaths has been decreasing over the last 2 days. So the rate of increase in cases and deaths is beginning to plateau now. So that is good news. So containment has worked. The problem we have with this virus is that it will migrate to other areas. And so we'll be having to play catch up. But hopefully during that time, more resources will be available and more different areas of the country will be prepared and will have learned from the epicenters like New York City.
My question actually, if it's okay, was what's the path? What is the actual path? Like, do you see it through testing? Do you see it through people with antibodies being able to leave their homes first? Is there any path that you see taking place so that we can actually leave our homes?
Yeah, I think it's going to come from a state level and not a federal level because there's disorganization there. But I think from a state level, I think we'll be given recommendations, the state and city level. I think your idea that if you're antibody positive, you're free to walk around, I think that will probably be one of the criterion, but most people will not have had the antibody test.
Will that be made widely available, or is that?
Yes, it will be. I think, as a practitioner, I can order tests for exposure to hepatitis B and C, HIV, etc. They're easily available. And this will be easily available as well.
And can anyone, do you envision people in the general population being able to take that, or only people who have had the virus?
It's a good question. I'm hoping that within a few weeks, it will be available to everybody.
Okay, thank you so much, and thank you for doing this.
Oh, of course, pleasure. Thank you.
Alan, go ahead.
Question about inflammation itself. What it is exactly and what causes it?
The virus or the bacteria or the fungus, the insult, initiates a response from the host, that's us. We are bombarded by foreign noxious agents every day, every minute. And we have an immune system that's primed to recognize these agents as foreign and start attacking them. But it's our inflammatory response, as I mentioned, can be sometimes unchecked and excessive. So this is one of the peculiarities of this virus. It's inciting an overexuberant inflammatory response. So we're all capable of inciting a response to this foreign agent. None of us have seen it before. We call in cells, they produce proteins that destroy the virus, break it up, digest it, excrete it. But sometimes in those who are getting sicker, that response is excessive.
We have a question about masks, Dr. Steiger. When is wearing a mask beneficial and what kind of mask?
Okay. I think if you're outside, ideally you should protect yourself. I know that it's hard to get hold of masks right now. So if you wear a scarf or something, bandana, whatever, I think that will give you some kind of protection. Admittedly, people, I think, are mostly protecting their space, private space, and the space of others. And the rule of thumb is 6 feet. I think the further you're away from people, the less risk of being exposed to droplets that we produce by speaking, coughing, sneezing, even just speaking. We exhale a lot of droplets. So keeping distance and if necessary, protecting your nose and mouth, if possible.
There have been, okay, you're done? Sorry.
Yeah.
There have been some questions about preventative measures that we can take. Obviously, you mentioned the mask. Anything else, including any vitamins that would help keep our immune system stronger?
Right. So that's a good question. First of all, I think that's a big question, Rabbi. So it's physical and spiritual. Physical, a good diet. Yeah, don't overeat. Not too much alcohol. Secondly, and equally importantly, sleep. Sleep is a great healer. Sleep is a great healer of the immune system. And I'm a hypocrite here, but all of us need to sleep at least 6.5, 7 hours a night, at least. And if you're tired during the day, during this time, you take a nap or two. It's good for you. Positive outlook, Rabbi. Here I'm guided by you, but I'm convinced that a positive outlook does help. Fear is a negative force, a profoundly negative force, and does not help us. It is hard not to be fearful and anxious. And however you choose to find peace of mind through your faith, through music, through friendship, through content. We're all separated, but we all could be connected. I think it helps. I think it really does help. Having a positive outlook. And Rabbi, it's a real challenge. How shall we gain that positive outlook?
Right.
It's not a pill we can take, is it?
It's not a pill, and it's probably for a different discussion. I don't want to take away everyone having a bunch of questions lined up, but I will say that it's a skill that we need to develop and work on, and it takes time and patience to focus our mind on the positive things in life and the things that we're grateful, and to really push away the negative thoughts. We have really control over our thoughts, and that's the key, to really take control of where our mind is heading. But we'll leave the rest for a different time. Another question, is it possible to get reinfected with the virus after recovering? That's number one, and I'll ask that second one separately. Go ahead.
That's a very good question. It is highly unlikely. There have been 1 or 2 cases of apparent reinfection, but it may be the same virus. I have to admit, I've seen 1 or 2 cases where patients they get better, but not quite better, and then they get sick again. And I think they never really cleared it. I think, yeah.
Got it. So would you say, I know that with the Seder, it's a very big deal. People want to celebrate with their family. And if you have a family where you have children who were sick and recovered and the parents were sick and recovered, would you say it's okay for them to get together and have
I think this is not the time, Rabbi, to take chances.
Got it.
What I've learned about this virus, it is so eminently transmissible. Let me tell you a story. The first case we admitted to Sinai West was about 3 weeks ago, and he's going to be leaving the hospital. He works in New York City. He's originally from Chile. He's a middle-aged man with high blood pressure. He went to Spain on vacation and met his friend who was from Italy. They had dinner together. He then went to Chile to visit his mother. And then he returned to New York and became sick. When he was sick, his friend from Italy called and said, I've tested positive for COVID. And while he was coming to the hospital, his mother called and said, I've tested positive for COVID, but I'm getting better. He did not get better. He came to the hospital. So I think within about 36 hours, the virus had arrived in 3 continents.
Right. Thank you. A question about proper social distancing outside, outdoors. What would you recommend as far as social distancing once you're outdoors?
Well, I think we should keep our space from each other. I shopped in Fairways on the Upper West Side 2 days ago, and that wasn't being respected. You know, they allowed everybody in, and people were buying, and it was not good. You know, I got out as quick as I could. Some people were wearing masks, but I think in general, you should try and keep your distance as best as possible.
Got it. I have a question here. Can you describe more symptoms and details about gastrointestinal issues and what one should be aware of and look for?
Yeah, the gastrointestinal symptoms are not specific for COVID, but specific for any kind of stomach upset, nausea, loss of appetite, and diarrhea. Some people only just get those symptoms and nothing else. About 10% of patients get gastrointestinal symptoms and nothing else.
Thank you. Then, should we worry about children being infected?
Yeah. Overall, no. Children get infected, but they rarely have to be hospitalized. It's most unusual. It's really unusual. So that's merciful. So it's very rare that a child, A, gets sick, and B, needs medical attention. But it's very commonplace that the kids, maybe your own small kids or your grandkids with a fever and a kind of a viral syndrome, at this time of the year, it could well be COVID.
Thank you. Someone here asked, I want to donate blood. Will this compromise my immunity in this climate?
No, donating a unit of blood does not. But if you're anemic, you should not be donating blood. And if you're donating blood, it's because you've done it before. This is not the time to donate blood. Well, if you're young and healthy, it's a blessing to donate blood.
Thank you. And then I'm not sure if you mentioned this before about the immunity builders. Someone asked about vitamin C in very large doses, that it helps. Is this a myth or can it really help?
You know, there's a guy called Linus Pauling who won 2 Nobel Prizes, and he took 18 grams of vitamin C a day, which is a massive amount. And he died at 97 years of age. And a lot of people are suggesting that may have helped. So vitamin C is very important. And if you're vitamin C deficient, you do not fight infections well. So in the last 2 or 3 years, it's been of great interest of giving intravenous vitamin C to critically ill people. And a study came out in 2017, and the main author is a kind of a maverick, and he demonstrated it was not a control study. He just gave it to consecutive patients who were very sick and found that their survival was better than expected. So that prompted a recent study that was published, which unfortunately has not shown any benefit. But I think there it was being used as therapy. So if you're asking, should one take vitamin C prophylactically? Definitely. I think you should take 1 or 2, maybe 3 grams. If you take huge amounts, I've learned in life, taking a lot more doesn't often translate as better. So if something is good, taking a lot of it often is not good. So I think if you take too much vitamin C, it may not help, and you can get kidney stones.
But you would say 2 to 3 grams instead of 1 to 3 grams a day?
1 to 3 grams, yeah. There is some literature that zinc supplements may have antiviral properties.
Right. There's a question here from a healthcare worker. Would you please comment on when a healthcare worker should return to work after recovering from probable COVID-19? Thank you. May God bless you and protect you.
Well, that's very kind. But so first of all, My answer is very imperfect because what I'm reciting is the Mount Sinai policy, and it's could be partly based on expediency. But the rule of thumb is your illness began a week ago and you're feeling better and you've been symptom-free for 4 days. So the implication is that if you're shedding virus, it's probably dead virus. And if you're feeling better, you should go to work. But we brought this up earlier. If you've been sick, you should not be in a rush to get back to work unless you're an essential worker. And then as a healthcare worker, it has to be run through the employee health service, and they will determine whether you can go back to work. So one should not rush to go back to work and start jogging and running and exercising. You should listen to your body and be cautious.
Thank you. Are swollen glands in the neck an indication of COVID infection?
No.
Okay, that was an easy one. I know we discussed masks briefly, but the specific question here is, do masks help us from getting the virus or just from transmitting it?
Probably both. In the hospital, we ask the patients to wear a mask to protect us. And similarly, when you're outside, this is a physical barrier. So protecting your nose and mouth, portals of entry of the virus, will help. The eye as well. If you really want to be a little obsessive, wear sunglasses, or eyeglasses. It might help as well.
Thank you. We have a question here from someone whose wife is a doctor at Mount Sinai, and he's asking if you're currently treating yourself in a prophylactic way with hydrochloroquine, or do you know any colleagues who are taking those corrective measures?
Yeah, so that's a good question. There is no evidence I know of that taking hydroxychloroquine prophylactically is of any benefit. Moreover, the data supporting the use of hydroxychloroquine for people who actually have the disease is not great either, but it has what I call in vitro, experimentally, it has antiviral properties. And it's a pretty safe drug. It's been used for 20, 30 years. And there are patients with autoimmune diseases who've been taking it for years and years. It has a good safety record.
Thank you. How many days prior to the onset of symptoms would someone be considered contagious?
It's probably a good question. Probably, we don't know. Probably 2 or 3 days.
Right.
Yeah.
Okay. And then, 1 second, going backwards now. I skipped a few along the way. If anyone has a question, you can also unmute yourself. But there was also one question about recommendation for talking to children about what's going on. What do you recommend to children to better understand what is going on with the virus?
Yeah. It's very hard for kids to understand the gravity of this problem. It's really hard, as witnessed, look at all the news stories of kids partying and then getting the disease and then infecting so many people and then bring the disease home and affecting their parents and grandparents. So on the one hand, we could be doctrinaire and say they're being irresponsible. I think kids need guidance here. And they need to be taught, if necessary, give them information, how potentially serious it is not to follow the recommendations. I think the message is slowly getting across.
Got it.
Speak.
Bishop, go ahead. Melinda.
Yes, thank you. So some of us are on serious immune suppressing medications. And also there's the people on chemotherapy who are in similar situation. And I'm wondering if you have a special or different protocol for patients who might come in with corona who are in that situation.
Yeah, so that's a very good question. We don't have a special protocol. We do not. Yeah.
Anyone else want to raise their hand, ask a question? Unmute yourself. Alec, go ahead.
Yeah, my question is on hydroxychloroquine. Is it possible that it could be very effective in people if it's given early and not by the time the person gets to the hospital and where it's not effective? So could the clinical trials that are going on in the hospitals with people with more advanced disease show that it's not efficacious when in fact it might be effective if given early?
So those trials are being taken right now. So they're targeting patients in the community who test positive with mild symptoms. That study is going on right now because we don't know the answer.
Right.
Alan, go ahead.
I understand that some people who have lupus are very concerned about their supply of this drug being cut off. And the reason that they're giving it to people with lupus is because it has an anti-inflammatory ability for the people who have the autoimmune syndrome called lupus. Now, it may not be an antiviral. It may be an anti-immune therapeutic. Which is it? That's the question.
Yeah. It is both. It is both an anti-inflammatory, and hence its use for patients with autoimmune diseases, and it has theoretical antiviral properties.
Two questions regarding kind of boosting immunity. One is, does physical fitness, particularly aerobic fitness, help withstand symptoms? And then number two is, a child with type 1 diabetes, any suggestions for improving their immune system?
Yeah. So the first, with respect to, we should all exercise. The American Heart Association recommends 30 minutes of aerobic exercise, including walking 3 or 4 times a week. But in the context of this disease, I would not recommend excessive exercise. We need to maintain our reserves. We should not be working out so that we're exhausted at the end of the day. It is not a good state to be in. I express caution. And the second question, Rabbi, was? A
child with type 1 diabetes, any suggestions for improving their immune system?
Yeah, that's a good question. If only there was a magic bullet, there is not. Just the same recommendations I gave before. Sleep, exercise, positive outlook, that intangible, sensible nutrition. Yeah. So Bess is here right now.
Hi.
And I apologize. I should have said this at the beginning and the middle and the end. Hand washing. How could I have forgotten that? Right. So hand washing all the time. Be obsessive about it. So obsessive that you get skin dryness and need moisturizer. So you cannot wash your hands enough. When you wash your hands for 20 seconds, use soap or alcohol based and then dry your hands.
Thank you. Eileen, you have a question?
Am I unmuted?
You're on.
Okay. Doctor, thank you so much. How concerned are you about people during this time who don't have the virus but become ill? Are they going to be having sufficient or adequate care during this time, in that the medical profession is so focused on the virus?
That's a good question, but let me reassure you. The hospital still works as a hospital, even though they've canceled elective surgery. So that's created a lot of space in the hospital. So patients who are waiting for surgery, that don't have a life-threatening problem, there's delays. So that's freeing up a lot of beds. So, but at Sinai West, we have about 150 patients with COVID. At Beth Israel, about the same. A little more at Mount Sinai, and about a little more at St. Luke's Hospital. But these are large hospitals. These are 300 or 400 bed hospitals. So there is room. There's Jacob Javits and there's a boat. And if things get bad, we can put, number one, the COVID patients, perhaps some of them in Jacob Javits. That's the plan. And for the boat, it's going to be a floating hospital with up to 1,000 beds. And they will be for non-COVID patients. It's like a military hospital. Not sure about the food, but.
If you suspect you've contracted the virus but never had a fever, when do you think a person would not be contagious?
Yeah, that's a good question. Probably about 7 days from the beginning, when you thought you may have contracted it.
Got it. But I'm assuming even at that point, you wouldn't recommend to stop the social distancing and just running around and going everywhere.
No, because you don't know unless you're being tested. The assumption is that we all have to maintain social distancing until everybody in the country has. So you're asking a big question here. Where we're going to be in a month, 2 months? I don't know yet. I don't know yet. But the trends are favorable in New York City right now. So I would not recommend taking a vacation in rural America right now, because eventually we'll hit rural America. So, and in New York, we have beds, we have resources. I think we should sit tight. Yeah.
Doctor, of the number of people who have been admitted to the hospitals with coronavirus, what percentage required ventilators?
Yeah, so about 20% of hospitalized patients require the intensive care unit, and a smaller fraction, maybe about 10%, require mechanical ventilators.
Any other questions? You can put it in the chat or you can raise your hand. Okay, Francine, go ahead.
Chat, you can ask
Yes.
a question.
Oh, I got someone else here. Okay, we got a chat.
You can ask, you're on. You can
Okay,
ask.
yes, okay. My husband and I often take walks in a park where there's no one around us. Should we wear masks? Are there possibly antibodies are floating around from virus from someone who walked there prior to our visit?
I think you can safely assume if there's really nobody around, you probably don't need to wear a mask.
Okay, and thank you for your service, doctor.
Oh, you're welcome. Thank you.
Bob, go ahead.
This is a personal. Hi, David. It's been a long time since I've seen you.
Yeah.
So it's a personal question. So I'm a patient of Dr. Sarpel's, who's recommended that I do HIPEC surgery for my colon cancer. But she said I have to delay it, or she'll contact me in 3 months. You think that's a reasonable estimate?
I think, Bob, you should keep in contact with your physician and have surgery as early as possible, as safely possible.
Yeah, so I'm going on maintenance chemo to deal with it, and I think I'm in good. I know I'm in good hands at Sinai.
Yeah, you look well, Bob. Good luck with that.
Thank you, and it's wonderful to see you again.
Nice to see you, Bob.
Another question we have is, why is the death level so high on ventilators?
So we're looking at a skewed population. We're looking at the sickest. We're looking at the sickest of the sickest. But I had mentioned that there are new therapies we're trying right now. And we've learned a lot in the last
No, I bought this earlier before that.
David, one second. Someone's unmuted over here.
Okay.
Okay, I think we're okay. Okay, sorry, David. Can you repeat that?
I think we're looking at a skewed population. We're looking at the sickest of the sickest. And in those who are on the ventilator, they're in respiratory failure. We are using new drugs now. We're using something called anti-IL-6. IL-6 is a cytokine. One of our friends here talked about the cytokine storm. So we're using anti-inflammatory medications to damp our own immune system. And I've seen some extraordinary results with anti-IL-6. There are antiviral agents that have been given now. And most of the main hospitals have these resources or have access to these resources. The purpose of the ventilator is to support the patient until they either get better or they get therapy, specific therapy that we're finding out may work quite well.
And then I guess kind of a similar question. Does the flu have the same effect on people with similar underlying health issues, or is this far more severe?
Yeah. Well, the flu is always worse when we're older and we have significant other medical conditions. Viruses in general, you know, we are more vulnerable if we're not in the best of health. But viruses are no respecter of people, person, or class. You know, viruses can affect kids and they can get very sick as well. What's funny about this particular virus is that almost all the kids who get the disease are either asymptomatic or have very mild disease. But kids are getting it.
And then some studies have shown some use of CPAP machines for less compromised patients. Has Sinai looked into this at all?
Oh yeah, we use it all the time. CPAP stands for continuous positive airway pressure. That sounds complicated, but essentially what it is, it's a machine that some of you may be familiar with because you either have sleep apnea or your spouse has sleep apnea or your your cousins have. It's just a mask you wear over your nose and or mouth, and it provides positive pressure. In CPAP is to prevent snoring. But in this condition, it's to help inflate and keep open the air sacs in the lung that is diseased. And we have many patients who use that alone and get better.
And this next question, I believe, was touched upon before, but is there currently a way to know if you may have had a mild case of the virus and not have known it?
Eventually, if you get the antibody test, that will tell you.
Right.
But again, it may take you a few weeks to develop the antibody. So if you're convinced and the antibody test is initially negative, be retested.
I have a friend who was sick with corona, sick for 10 days, waited a week, wanted to give blood, and she still tested positive to the COVID virus.
Yeah.
Oh, am I on? Oh my God.
Yes.
I didn't know I thought it was recording.
That was live.
I'm sorry. So when she went to get tested, she was still positive. Now, do you think that was dead cells?
Yeah, quite possibly. Yeah, quite possibly. But that we were.
Because she's quarantining again, and.
Yeah. Well, I think it's best to be safe because we don't know, but it's quite possible. If she's feeling better, then probably it's dead virus.
Yeah.
Yeah.
Yeah. So there's no way of knowing for sure.
No.
Wow.
Someone asked, and I think we've answered this also, that it's not ready yet, but is there a way to get an antibody test in New York City?
Yeah, but the thing is, I know that the Sinai system is offering it in a week's time to healthcare workers. And I imagine it will be available for everybody quite soon, but I don't have a timeline right now. But, once this technology is available, it becomes available throughout the country very quickly because there's commercial interest here. A lot of labs are creating these tests, and some of the tests can give you a result in less than a day.
Then, do you have any thoughts on mail, newspaper, and food delivery sanitizing?
Well, Bess tells me this, and I have read that we should be careful, that we should be cleaning the boxes and cleaning but we don't know who's been packing the material. Look, I think you have to be as obsessive as possible without driving yourself nuts, but using sanitizer to clean the box and the contents of the box without damaging the food. And I think it's a good idea just to be safe. Yeah.
And then another one over here about someone saw a video with, and he's not sure whether it's valid or not, but the pulmonologist saying that the lung impact is not the same as regular pneumonia. Is it just a video that was produced to scare us, or is this regular pneumonia that develops?
Well, pneumonia is just the inflammation of the lung, but it's a little different from a bacterial pneumonia. It is similar to other viral pneumonias. The management requires critical care in the minority of those who get sickest, and the kind of management we provide is the same kind of management we provide for people with terrible bacterial pneumonias.
Thank you. I may have missed some questions in the chat, so if there's a question that you really wanted to ask, you can either quickly put it in there. Can someone get the virus twice? And also, have you heard of a drug called low-dose naltrexone?
Yeah. So first of all, I don't think you can get the virus twice. I think in some people, the disease, however mild, can be quite protracted, maybe 2 or 3 weeks. So I don't think you're getting it twice. I'm not familiar with that drug for this disease.
Yeah. Thank you. Another question, which I believe is a practical question for this individual. If you have someone who tests positive in a congregate setting like a motel, where people have separate rooms with their own baths, how dangerous is this for the other residents in their rooms or the employees, and what PPE would you recommend for the employees?
Yeah. So, people who work in the hospitality trade are very vulnerable. Now, everyone should be hand washing, both the hotel employees and the guests and all the guests. But the problem with hotels, people congregate they congregate in lobbies, they congregate in the places to eat. So hotels are high-risk places to hang out.
I think this question was specifically about homeless shelters or nursing homes and those types of things where people are remaining in their own rooms.
Yeah.
And is there a danger if one person tests positive? Do they have to evacuate the whole homeless shelter, or are the other residents in their room, separate apartments? Are they safe?
Well, it's a problem. No, we don't have enough resources. I think in nursing homes, I think they try and quarantine the sick residents into private rooms, and the workers who work there, they should wear PPE, and they should discard it after they've seen the resident who is ill. It is a challenge in the nursing homes. I worry about it.
Thank you. Eileen? Oh, sorry, you're on mute. One second. Go ahead, start again.
Many of us live right near the county center, which is getting ready to be a site there in terms of taking care of patients with the virus. Is that a worry to us that live within a mile radius from them?
Not at all. No.
Similar question to the last one. What precautions should be taken in apartment buildings?
So I live in an apartment building with Bess, and we're not encouraged to share elevators with other members of the building. And the doorman stands a healthy distance from me. I thought he didn't like me anymore, but he's just following protocol. And they really do stand aside, and they have a look of fear, and it's sad to see that. So social distancing in the building, areas should not congregate, no socials, isolation. It's very unpleasant, but we have to do that.
So a question about the antibody test that you mentioned before. How is the test actually administered?
It's a blood test.
And then if a patient is noticing shortness of breath for over 10 days, but oxygen levels above 94%, is there anything that should be done?
If the patient is otherwise well, they should stay at home. If the shortness of breath is getting worse, or the oxygen level is falling, then you should speak to the doctor about coming into hospital.
Neil, go ahead. Neil, we don't hear you for some reason. Okay, Neil, I'm going to leave you unmuted, but we still don't hear you. So if you can figure it out, put it in the chat, because we don't hear you for some reason. So meanwhile, Dr. Steiger, if I can ask you, I know there's been a lot of talk about individuals who are admitted to the hospital for the virus. They're obviously there all alone, and their family cannot visit them. And one of the struggles is, how do you communicate with the patient, with the nurses and the doctors? And I've heard some frustration from many family members who have relatives in the hospitals that they can't seem to really stay on top of what's going on with their loved one because there's such a disconnect and they can't go visit and they can't really be a patient advocate. So based on what you've seen in the hospital, any recommendations, God forbid, if you have a family member who ends up in the hospital, as to how to stay on top of what's going on with them?
Rabbi, I think this is the most awful manifestation of this disease, that our loved ones are sick in the hospital and they are isolated and full of fear, and communication is difficult. God forbid, if any of you or your family members go into the hospital, bring your cell phone. It's a lifeline. It is so important. They have phones in the rooms as well. Getting physicians and social workers particularly, and nurses, are doing their best to communicate with families. That is being done.
Thank you. Neil, go ahead. No, sorry, Neil. You're not on mute, but we still don't hear you. I'm not sure why. No, I apologize, Neil. You want to put it in the chat because we're not hearing you. Sorry. David, so unless you have any other questions, there were some questions that I skipped before because they were more of on a personal nature. People wanted to know how you're holding up and what we can do to help you and other doctors and nurses on the front lines.
All right, that's very kind of you to ask that, Rabbi. But whenever I talk to you, I'm inspired, and I have more positive thoughts than negative thoughts. It's a challenge. It's a challenge for all of us, and these are really unprecedented times. None of us have ever experienced anything like this before. We will get through this, I have no doubt about it. And I'm encouraged how the death rates and admission rates are beginning to fall now. So social distancing, quarantining is working, however difficult it is and challenging for everybody. We are all social creatures and we're not used to maintaining this level of isolation. It is a very, very real challenge. I think we'll have a vaccine. It will take time, but the vaccine will be much sooner than the experts are saying, because there's an extraordinary advances being made right now. A lot isn't being known about the disease. And the most positive thing I can tell you is that America First doesn't work. What's happening now is scientists throughout the world are collaborating, communicating, sharing research, sharing their secrets, sharing the sequence of the virus. And because of that, there's a common goal throughout all nations to find a definitive treatment for this and a vaccine for this. And so I think we're seeing the best of humanity in the collaboration of scientists throughout the world in trying to end this disease and prevent further waves of epidemics. So I look forward to that, and I think it's in our near future.
Thank you. Neil, we'll try again.
Oh, thank you. Can you hear me now, Rabbi Benji?
Yes, we can hear you.
Oh, thank God. Oh, yes, yes. Thank you so much for doing this. Dr. Steiger, I called you Rabbi Steiger. Dr. Steiger, thank you so much for
David,
doing
yeah.
this. I really admire you. I'm praying for you. You know, you're right in the middle of everything. I am a healthcare worker, and frankly, I'm scared. It's brought me a lot closer to God, and thank God for my family and for Chabad. That has helped me a lot. Right now, I wanted to ask for your practical advice to protect my family. I'm completely living in my basement. Thank God I have a livable basement. I keep my shoes outside the door. I spray Lysol over all my stuff. My hospital, until like 2 weeks ago, was telling us not to wear masks. I got sick. I got better. But now there's saying, wear surgical masks and wear goggles if you have a patient who's coughing. Basically, my wife is from China. She completely freaked out with those recommendations. So she turned me into an astronaut duck. So basically, I go to work as an astronaut duck every day I have 2 N95 masks. I'm wearing the same one over and over again. I have goggles. They broke a little bit. I fixed them up with tape. I have this head covering, and I don't know, is there anything else I should do? I'm sending my laundry to a service, so I don't use the washing machine. Should I make a will? Rabbi Benji's already agreed to do my funeral if, God forbid, I need it.
At 120.
Yeah, thank you so much. Anything else? I mean, look, I'm not in the ICU as you are. I feel kind of like a wimp telling you how scared I am, but I am scared, and right now I have probable COVID-19. I'm recovering. I'll probably get sent back to work.
I have a thought.
Okay, so Neil, we lost you again. Unfortunately, we don't hear you anymore.
Oh, sorry.
So how about I'll let Dr. Steiger comment. We'll let Dr. Steiger. Dr. Steiger, go ahead.
Neil, you look well, and I hope you're on the road to recovery.
Thank you so much.
And this is what I do. So I used to wear a shirt and tie. I sort of underdress, and I go to work, and then I change into scrubs. And when I see patients, I do what you do. I wear a gown and gloves and glasses and a visor. And I wear a mask throughout the day, a surgical mask. And then when I see a patient with COVID, I put the N95 first and then a surgical mask, which I can then throw away. And when I come home, I take all my clothes off, make sure the neighbors can't see me, go to have a shower immediately, and then dress again. And, I recommend it's best that she goes into exile and leaves me. But I got very lonely and she felt sorry for me. So we're in this together. We can only do so much. We can just do our best here. And I admire you for what you do. We'll get through this. We just have to be as sensible as possible. as sensible. We can, yeah.
Thank you so much, Dr. Steiger. You know, hearing you say that means a lot. I pray for you and your wife. You're very, very brave and noble. I really appreciate that. Another thing, a lot of people in our synagogue have really taken up the cause of this hydrochloroquine with Dr. Zelenko. You know, the governor has prohibited it to be given to outpatients. I'm hoping that this will be a cure. What do you think about that? Will he ever release it?
Okay. So I mentioned before the data describing its efficacy is really meager, but I think we'll know in the next few weeks some studies possibly showing benefit. Full disclosure, I have to be honest. When I started reading about it, I got some, and I feel bad about that, and it's in my medicine cabinet. And God forbid if I get sick, I would probably take it. Because I think it does minimal harm, and I think it may be a benefit. And we're all looking for something, right? Yeah, and I'm just hoping that production of this drug will continue to increase so that there are no shortages.
And I think that
some more questions came in, Neil, so if you don't mind, I'm going to ask some of the other questions. So we have a question here from a community leader in Florida who joined us, and he wants to know what we should do in Florida with many elderly people who, being that they've seen almost no cases in their area on the West Coast, people are getting lax with social distancing. Will we see what New York has seen now?
Well, I think what's unique about New York is the density of people. Right? That's what the epidemiologists tell us. So I think a lot of people getting sick at the same time is an experience of a big city. It was in China and to some extent in Italy. Unfortunately, there is no part of the world which is safe from this disease. If people in Florida practice social distancing and isolation, if that's practically possible, then that's what they should do for as long as possible. Because no one is invulnerable from this disease. They are not.
Thank you. Then there's a question, how will this end? Which I'm going to answer that one soon. When people go back to work, won't the COVID still be there, and what prevents it from starting up again? And then also around the world, we see workers spraying buildings and streets, and we don't have that here, question mark.
Yeah. You know, these are very good questions about how will it end with respect to this virus. I mentioned that this coronavirus, all coronaviruses cause the common cold, and they come and go, and they're often seasonal. And then the two coronaviruses in 2003, the SARS virus, and then the MERS virus in 2010, they disappeared. And is it because they became less virulent? Is it because the climate affected its behavior? Possibly both. With this virus, we don't know. And that's a problem. And it keeps me up at night worrying about that. The answer will be a vaccine. And the sooner that's better, it will prevent either further waves of disease and different mutations of the virus from coming back every year.
Thank you. And then I think one last question, then we'll let you go. Feel bad keeping you so long. Two last questions, sorry. Before I go to Alan, how do you encourage your healthcare workers to be able to endure during these times and be able to help their patients?
You know, I'm older than most of the people I work with. I have some older colleagues, and we try and support each other. Food is a good thing. We like to, in general, we like to eat together, and, you know, as an expression of friendship and sharing food, we can't do that. So food is delivered, then we get the box, and then we disappear. So nutrition is important. Counseling, there are services in the hospital that are available for those who are having a tough time, and some people have to take a few days off. And we have rotations now where we work about 4 days in a row, then a day or two off, and we try and space it out. We're getting recruits from all over the country and volunteers who are working with us. It's really amazing to see these people.
Thank you. Alan?
I thought about the mask that that previous gentleman was talking about. He was reusing his mask or using it for a whole day. Well, my thought is, what about UV light? By putting UV light on the mask and sterilizing it that way, or even putting it in a microwave as long as there's no metal in it. That could kill the virus. It's not a strong virus.
Well, so you're right, UV light does kill the virus, but who has access to UV light? You know, some hospitals are using it, but if you're talking for people at home, I don't know if a microwave helps, I don't know. And make sure that only you are using that microwave and not nobody else, right? You don't want to spread contagion in one of your kitchen devices. So you're right, UV light does work, but it's not being used routinely in most hospitals. You know, ironically, we used UV light for years against tuberculosis. And the tuberculosis floors, we had UV light to decrease risk of contagion.
Mindy?
If my, first, you know, again, with deep gratitude, I think from all of us for doing this evening. And all of the frontline workers, I think, are on everyone's minds. So thank you again. And my last quick question to you is, so if this antibody test comes up, okay, and you test that you have antibodies, would that make it safe for you to work in an environment where people have the illness? Like, for instance, if I wanted to volunteer in a hospital after I came out with antibodies, would it be safe for me to do that?
Yes, only if you wear masks and gowns and gloves.
Well, if I still, right, but it would be safer than if I did it, because I would be more concerned about coming home to my family.
Yeah.
So, but if I tested positive in terms of the antibodies, relatively speaking, just in general, I would be safer from getting it.
Yes, but I would still express caution until we know more about this disease. But
Okay.
most theoretically, yes. Yeah.
I have a quick question. David, are there many false positives and false negatives in these tests?
So the PCR test, the nasopharyngeal swab, has a false negative rate between 20, 30, 40%. There are no false positives with this.
Thanks.
Sure.
I think last question. I've heard that another wave may occur in the fall. Is that likely? And if so, can the virus mutate so that a vaccine or antibodies not work?
So all viruses mutate. And the reason why we have flu epidemics every year, and we need a flu vaccine every year, because the flu virus that visits us every year is different from its ancestor the year before. The coronavirus, there are different variants of it right now. And virologists are sequencing the viruses. They're different, but they're causing the same kind of disease. It is probable that this virus will mutate, and it's possible that it will come back. The hope is that we have a vaccine before. The virus that comes back, will it be the same one or will it be a variant? We don't know yet. And we don't yet know the effect of climate and seasons on the behavior of this virus yet.
So just to conclude, first of all, Dr. Steiger, thank you so much. I know you have a lot on your plate right now in the line of work that you do, and to take the time to talk to the community is really very, very gracious of you. And I know this was your idea, you volunteered your services, so we really, really appreciate it on behalf of the whole community. Thank you so much for what you do in general and for tonight. And just to conclude with a positive thought, many of the questions are about how does this end, what's the path forward. The Talmud says, Yeshuat Hashem keheref ayin, the salvation of God comes in the blink of an eye. And sometimes things change so rapidly, even the way we got into this mess. You see how quickly the whole world unraveled. None of us expected this to happen so quickly in such a drastic way. So if this can happen, we can get into this mess so quickly, we can also get out of it just as quick. And God willing, we're celebrating Passover, it's a time of miracles. So God willing, we should be able to celebrate Passover together in Jerusalem without any viruses. David, thank you so much. We really, really appreciate it.
Thank you.
Have a wonderful evening, everyone.
Thank you, everybody. It's an absolute pleasure. Thanks, Rabbi. Take care.
Good night.
This is Pesach.
Thank you, Doctor.